So today's topic, and I'm going to do a YouTube on this fairly soon. Today's topic is trichotillomania, and the only reason I am talking about it this morning is that my second client suffers from trichotillomania, and she's only 21, and I'm discussing her case today with her full permission. This is something that we are seeing more and more here in Brow Teak, and for those of you who don't know what trichotillomania is, it's usually in young girls whereby they incessantly pull out their brow hairs, their lashes, and more often than not as well the front part of their fringe area here. It's a nervous disorder. It is something that needs emotional support with, and it's something that I can help hugely from the confidence point of view. So obviously, for confidentiality reasons, I am not going to use her name. Let's call her Molly. And Molly came to me quite a number of years ago. She's 21 now. I'd say she came to me when she was 17. And it was a distress phone call from her mom because there was an issue at home, and the mom wanted to help her. The daughter, Molly, was, I think, maybe 5th year in school, not having an easy time at school, and then every morning obsessing about putting on her eyebrows with her pencil, not getting it right, too thick, very natural looking, and was drawing attention to her face for all the wrong reasons. Now, she's a lovely, mature girl now, and we've had such a lovely conversation this morning retrospectively. So, from an emotional support point of view, this little lassie, Molly, did not find psychotherapy or counselling very beneficial. And of course, she was at the age, and she says this even now, she was rebelling. So if it was recommended that she do something, well, then she would rebel. And so she didn't find it very useful, but a lot of people will find it very useful. That's the first thing. The other thing is that even 4 years ago, she had said, she had her eyelashes pulled out also. I'm going to show you some photographs now. And the use of false eyelashes, you remember the strip lashes? They only became fashionable in the last number of years, and she had started to use those, but they were really not great, whereas now they're absolutely wonderful. So she wears strip lashes every day. She's been coming to me for the last 4 years and has matured so much. I remember when I met her the last time that I had said, "Oh, you haven't given up pulling yet," and she just said to me, "Olive, actually it's an addiction." So it's a bit like asking an alcoholic to just give up alcohol. So there is an addiction side to trichotillomania. So saying things like what I did to her back then, well, is very unhelpful. So we had, as I say, we had a lovely, frank discussion today in relation to her age group and what not to say. So I was actually coming from a professional point of view because I was able to fix her eyebrows, but I was also coming at her from a mom point of view as well because she was so young. So what not to say is, would you ever just stop pulling? She described her very first visit to me 4 years ago as life-changing, and she said that is not something that you would say lightly. There was anticipation about the soreness, and if you know anybody who's got trichotillomania, the message that she wants delivered today is that if you think pulling out your brow hairs and your eyelashes is sore, microblading is a piece of cake in comparison. Now, as a registered nurse, I actually use a triple anesthetic, so you feel very little, usually about a 2 or 3 out of 10, whereas 10 out of 10 would be labour pain. So it's a mere scratch. So she had said, yes, she was very scared coming to me first day. She was 17, therefore she had to have her mom come with her. She needed to have parental support because the legal age is 18 for a tattoo. So now that we're in COVID, anybody who's under the age of 18 and needs to have their eyebrows done as a result of tricho, their parent has to sign the consent form as would be the case for anybody under the age of 18. But because of the health and safety restrictions, that person then has to sit outside the door. I will leave the door ajar for sure. So this is something, to be honest, if the 15, 16, 17-year-old little girl says to you, I want to have it done, they want it done so badly that they don't mind that they are alone with me in the room. One of the things that Molly said to me as well is the fact that I was a registered nurse. She felt very held and cared for. So, thank you. And she remembers the elation of having eyebrows when she came to me 4 years ago. So, and I remember her well, actually. She was like practically in a school uniform when she came to me, and I felt, well, she was the same age as one of my own children. So I felt I needed to embrace her, although with COVID now we can't hug her or shake hands or anything anymore. So what I'm going to do now is I'm going to show you some before photographs, and if you're not interested or if it might distress you, please just tap along. She's given me full permission to disclose these. You won't see her face, it's just her eyelashes and her eyebrow area, and the transformation of the time and what she looks like today. Such a happy girl. When you have trichotillomania, because with the pulling of the eyebrows, there is very, very minor scarring, something that you won't even see, but it's actually in the skin. Therefore, we have to do the microblading, and we actually have to use a special tool to do micro shading extra so that it actually is a nice natural look. So this isn't her, by the way, but it is it's very important that that the integrity of the skin is maintained. Therefore, we will give you a full detailed information in advance as to what you are to expect, so that you're not receiving information from well-meaning friends who said, oh, I had that done, it lasted 5 years, and they're coming back every 6 to 8 months. And that's because of the scarring. So when you sign up to have your eyebrows done, it's a 3-step process to start with, and then we see you every 6 to 8 months then for what we call a colour boost. And Molly missed out on her colour boost because of COVID and because I had to close, and she was 10 months waiting to have her colour boost as a result. And to say that she floated down my stairs 20 minutes ago is an understatement. She's so delighted, and and she's warned me that I'm not to retire. So you do become you become friends, and I have no idea really the emotional support that I actually give them. Get beautiful brows, but you become, it's a bit like your hairdresser, you become very attached to the person who does your brows, and you become invested in. Okay, so the first photograph I'm going to show you in the next shot is of Molly when she came to me at, I think she'd just turned 17 when her mom rang me. And at this point she had no eyebrow hair, she still doesn't. And she had all her eyelashes pulled out as well. So the quality of my phone back 4 years ago, I think it was fairly crap. And these were the photographs. So just so that you know, the photographs are not the best of quality, but you'll still see the message. So this is what she came to me like back in Cork City when I had a clinic there 4 years ago. Here we go. So she had eyeliner on to accentuate the fact that she had her eyelashes removed as well. And she was wearing strip lashes. And as I say, they've come on so much in the meantime. So herself and myself had a discussion as to whether we would do microblading on its own, whereby you have hair stroke on its own, or whether we would actually do microblade and microshade, whereby you have microblading, which is the hair strokes, and then you have shade extra, whereby it's kind of a powder fill on top of it, and that gives more of a defined look. Because of her age, we initially started with microblading on its own and then decided to go straight through to microblade and microshade, which is an extra service, because it was going to serve her better. They wear lovely defined brows at that age, and I wanted her to look like her peers. So here we go. That's microblading on its own, and once that healed, it actually faded off to nothing really. It faded by a good 50%. And when she came back to me for her next step, she actually said to me, Olive, it's not dark enough and it's not defined enough. So then we took her to the next level. Now bear in mind, I start conservatively, because if we go too thick and too dark, and too defined, we can't take it away. So it's easier to build up into this. So together we worked through. And here's what she looks like today. One of the things that Molly says, that she knows that her flatmates, now she doesn't live in Cork, she knows that her flatmates knows that she pulls her eyebrow eyelashes all the time, but none of them talk about it. And for the most part, she said that it is something that she doesn't want to discuss until she's ready to tell. She has a couple of close friends that she has discussed it with. And interestingly enough, the girls that she has, her peers that she has confided in on what she does, a couple of them actually said to her, I used to do that when I was doing the Leaving Cert. Isn't that interesting that, you know, this girl, there is no support group for trichotillomania sufferers, and she would be fabulous. And I do think this gorgeous girl is destined for very great things. She's in a caring profession now, and we had the discussion that she would be fabulous to set up a support group for tricho. Now she's 21, coming on 22 soon, and I know that this is going to be her path, and I will be watching this journey of hers for as long as I'm going to be in this business. Now she did threaten I'm not allowed to retire in the next number of years. I think she looks at me and thinks that I'm 20. Lads, I'm 57. Anyway, there's a happy story. So thank you so much, Molly, for allowing me to share your story today. And it will give so much help to so many people. I am going to do a YouTube video on it over the weekend, possibly. Although I'm busy this weekend now. Yeah, we'll see.